welcome to all who are joining in today. I am Dr. Arun. I work as a senior consultant and head of my medical gastroenterology. The objective of today's discussion is to generate awareness of people about hepatitis. So, what do we mean by hepatitis? Hepatitis uh, means an inflammation of liver. So, inflammation means tissue reaction or swelling of tissues in response to an injury or toxin. Inflammation can affect liver functions and sometimes lead to permanent damage in liver structure as well as function. Inflammation can be due to a variety of causes. The commonest causes include viral hepatitis. There are 5 types of hepatitis viruses which can affect the liver. Similarly, there are non-hepatic viruses which can also injure liver. In addition to viruses, alcohol, drugs, toxins, etc. can also damage liver and cause liver inflammation or hepatitis. Liver inflammation can also result from immune related disorders. This variety is called autoimmune hepatitis, wherein because of an immune dysregulation, liver cells become victims of injury or inflammation. Liver inflammation can also result from autoimmune conditions where the body's own immune cells attack the liver cells and cause damage and inflammation. When we talk about viral hepatitis, there are various viruses which can affect the liver. Hepatitis A and E virus is usually acquired from contaminated food or water, whereas hepatitis B, C or D viruses generally are acquired by contact with contaminated blood products. Alcoholic hepatitis generally occurs in people who consume excessive amounts of alcohol. Up to 1/3 of people who consume alcohol may develop alcohol hepatitis, and sometimes it leads to permanent liver damage. The chances of a person getting alcoholic hepatitis are high if the person consumes excessive amount of alcohol, and women have a higher risk than men to get alcohol hepatitis. People with obesity or high body weight have a higher risk of getting alcohol related hepatitis. People with a genetic risk as well as people with obesity are also prone to develop alcoholic hepatitis. Now, how does one know whether he or she has hepatitis? Very often, hepatitis may not be easily detected. It is detected only when we undergo some blood test. But common symptoms include excessive tiredness or fatigue, nausea or lack of appetite, fever, flu-like symptoms, or yellowing of eyes, skin, or body fluids. How does a doctor make a diagnosis of hepatitis? So, this is by careful history taking and physical examination where he can detect jaundice or enlarged liver. Doctors also advise blood tests such as liver function tests and tests for specific viruses to identify the cause of and presence of hepatitis. A doctor may advise blood tests such as liver function tests and tests for detecting various viruses to identify and establish the cause of hepatitis. In addition, he may recommend an ultrasound scan to look at the structural changes of the liver. What is the natural course of hepatitis? Hepatitis may be acute or a short-term illness, or it may become chronic, that is, it may persist for months to years, and eventually in these cases cirrhosis can develop. Cirrhosis is a condition where there is shrinkage of liver and compromise in liver functions. How does one treat hepatitis? Hepatitis is treated by a variety of non-pharmacological methods as well as medication. So in many cases, hepatitis may be self-limiting, such as infection with hepatitis A and E viruses. In many cases, hepatitis may be self-limiting. For example, hepatitis A and hepatitis E infection. So here, with attention to adequate nutrition and supportive care and bed rest, patient might improve himself. However, there are other types of hepatitis such as hepatitis B, hepatitis C, where infection may persist for a long time and continue to cause liver damage. This type of viral hepatitis is treated using medications. We have cure for hepatitis C with antiviral medication, and further progression of liver disease can be controlled by use of antiviral therapy in hepatitis B infection. In case of alcohol related hepatitis, quitting drinking is the first step. Correcting malnutrition or nutritional deficiencies in the patient is also of paramount importance. In addition to this, counseling the patient, controlling the withdrawal symptoms, and slowly weaning him away from the drinking habit is important to prevent further liver damage. In a patient with hepatitis, it is very important to avoid other medications or chemicals or substances which can damage the liver. So it is very important to alert your doctor if you suffer from one of the types of hepatitis. Many forms of hepatitis can be prevented, especially the virally transmitted hepatitis. Vaccines are available for hepatitis A infection, hepatitis B infection, and hepatitis E infection. So how do we, in addition to vaccine, how else can we prevent getting hepatitis? So this is by being careful about our food and water. We should ensure that we do not consume contaminated food or water. We should also ensure that we take vaccines for hepatitis A, hepatitis B, etc. We should avoid consuming alcohol or using pain medications or paracetamol without prescription. We should avoid contact with blood products, and we should avoid unprotected sexual intercourse, especially with multiple partners, in order to avoid hepatitis. In addition, a healthy nutrition and maintaining a correct body weight is also very important in prevention of hepatitis. So how can we keep our liver healthy? It is by adopting a healthy liver style, a balanced diet, regular physical activity and exercise, avoid taking medication without prescription, and health supplements where the contents are not clearly known to be problem free. Ensure food and water hygiene. Avoid handling contaminated blood products without protection. Adopt safe sexual practices. Avoid consuming alcohol and other substances of abuse. So the take home message I would like to give is, as far as hepatitis is concerned, prevention is always better than cure. And in case we suffer from hepatitis, do not lose hope. Many types of hepatitis are self-limiting, and some of the types are amenable to cure or control using treatment. Importantly, do not lose hope and consult your doctor at the earliest.